Good morning, everyone. It is 9 o'clock, so we'll go ahead and get started. People continue to join, and that is just fine. I'm Christy Ganya, a program manager for Telehealth Rocks. And Telehealth Rocks is a federally funded program that focuses on school-based behavioral health. And we do this by working on social determinants, supporting school-based services, and telementary trainings just like this one. In addition to our speakers, we've got Telehealth Rocks team members here today, Haley Bell, Chase Koo, and Sage Brown. They may be putting items in the chat or responding to questions during the session. Feel free to reach out to any of us if you need anything. We're glad you're here for this session to discuss social and community context. We've got just a few notes for you as we get started. So this session is being recorded and we'll send it to you afterwards. Your microphones have been muted. You can use the chat or unmute to ask questions. And then it's very helpful to have your first and last name visible on your Zoom screen so we can track attendance, or put your name and organization in the chat. We don't have any disclosures, and everything presented today is evidence-based and currently accepted within the profession. And then after the session, we'll share the slides and recording as soon as we can. All the links and resources that are noted on the slides will also be sent in the follow-up email. Your certificates of attendance will be emailed after the series ends. And then please feel free, if you have any questions after the series or after the session, to just give us an email to the Telehealth Rocks inbox, telehealthrocks@kumc.edu. So with that, I will hand it off to Robert and Evelyn to get us started here today.
Well, I can start. Sorry, I never know who does what sometimes. So I'm really pleased today to have Dr. Evelyn Nilsson, who is the principal investigator and executive director of our work here at Telehealth Rocks, and a child psychologist, and she can talk a little bit, and she's going to do a lot of the presentation. But I'm especially also excited, of course, always to have my boss here, but in addition, to have Stacey Tweedy and Erica Doherty. Stacey is the Southwest Regional Director for the Kansas Department for Children and Families. And Erica works in the Hutchinson Public Schools and with a program that DCF sort of helped found. And we'll learn a little bit about why they do this work and why it's important to the school district, as well as important for the families that DCF serves as well. So next slide, please. So I'm gonna Evelyn, yeah.
I'll also really excited with this panel today. It's great to see online some returning faces from our previous echoes in this series. We always like to start off asking if you've had any experiences in the time between we presented last. If you put in anything into practice around our last session around neighborhood and built environments, or really around any of the sessions, we'd love to have you type in the chat any lessons learned or any resources folks have discovered that would be great to share with this community. We'll give you just a minute for that. I know we've got a lot of great information to cover today, but feel free to type that information in as we're going through the slides. Looks like we don't have any immediate things coming to mind, but again, as we talk today, we'd love to hear from you about anything or things you put into practice from the series. We'll go ahead to the next slide. So today, just to summarize, we're going to talk a little bit around relational health and safe, stable, nurturing relationships and environments that are part of the social and community social determinant of health. We're going to review the role of social and community contexts in the lives of children and families, really focused in on the concept of social capital. We're fortunate to discuss one state agency and one school district's impact around social and community contexts for student and family success. And then we'll assist participants in considering potential partnerships for schools that might impact this important area. Next slide, please. I think I hand off to you here, Robert.
Sure. So the social determinants of health, just as a reminder, we come back to this every month. It's all those things that kind of go into uh, whether you're able to be healthy, whether you have the resources you need to be healthy, and you can look at some of those there. Next slide, please. So today we're really looking at the social and community context, and those are those factors that relate to relationships with family, friends, coworkers, and community members. And we can see how important it is for kids as they're successful in school and in life. Next slide, please. So when we think about what is social and community context, it's things like your relationships and your interactions with your family, your friends, and other community members. And it can really have a major impact on your health and well-being. So when we talk about what the federal government what the goals are for us as a nation, we really want to, this idea is that we're going to focus on helping people get the social support they need, where they live, where they work, where they learn, and where they age. So we know that many people face challenges and dangers they can't control, like they live in many of the social determinants we've talked about so far in these series, things like unsafe neighborhoods, discrimination, or trouble affording the things that they need. And this can really have an impact on your health and safety throughout your life. And I started working with migrant farm worker kids way back in 1998. And one of the things I found were those kids that had someone in their life that they served as a mentor, but also served as a strong relationship for them. Um, Often, despite, when we hear a lot about kids who grow up in poverty and are then successful in life. And so much of the social and community context goes into how those kids are kind of over to be able to overcome the things they lack and their environment or issues in their environment to continue to be successful in school and in life. So that really leads to this idea of positive relationships at home, at work, and at school that really it reduces the impact of those negative circumstances they may find themselves. Some kids, like kids whose parents are in jail or other issues, often don't get the support that they need. And that's where mentors and others in the community and in the school can really play a role. So when we think about ways to impact the social determinant, we really look at interventions that help people get the social and community support they need. And that helps their health and their well-being, but it also improves education success and life success. Next slide, please. So here are the Healthy People 2030 goals, and I always want to talk about what are the ones that really relate to kids and schools. So reduce the number of kids whose parents or guardian have been in jail, increase the number of adolescents who have an adult they can talk to about their problems, adolescents in foster care who show signs of being ready for adulthood and life success, children and adolescents communicate positively with parents, children whose family read to them at least 4 days a week. That is a social and community support area. The portion of children and adolescents who show resilience to challenges and stress. We want to create resilient kids so when things happen like the COVID pandemic, they're able to come back to school and ready to learn and kind of overcome that trauma in their life. And then things like eliminating low food security in children. Next slide, please. So as sort of a start to our conversation, I just hope that, this is from a group called the Search Institute, which has received funding from Bill and Melinda Gates Foundation at the time, to really think about kind of what this area of social capital, how it impacts and what we can do to help create more of these social and emotional ties for kids. And, one of the places to start is to really think all of us have had an adult who inspired or encouraged us to reach our goals when we were younger. And that's what's led, hopefully, been part of all of us leading to our life success. So I'm going to pass on here the next slide to Evelyn, and we can talk a little bit about sort of the background for why this is so important.
Thank you, Robert. I think that last slide is so important, and I hope you'll keep that person who inspired you in mind as we go through some of these slides. We'll talk about some of the research language and all, but um, uh, there's a renowned developmental psychologist who kind of put this into a nutshell. When we're talking about all of this, it's kind of like someone really has to be crazy about that kid. Who was that kid's champion? Who was their person who kind of looked out for them? So kind of keeping that mindset as we go through these slides, I think is super helpful. Um, so in my own field of pediatrics, we've had a real shift in thinking and really have focused in on this concept of relational health. And it really goes hand in hand with the social and community social determinant that we're talking about today. So relational health focuses in on what do the relationships look like? Really those building blocks in relationships, the building block of community. So looking at a safe, stable, nurturing relationship, or SSNR, and the environments in which they occur. This can be at the parent child level, at the didactic level, um, with really anyone fulfilling that parent guardian role. It can be at the familial level, so a little bit bigger circle. And it, of course, is at the community level. And that's a lot of what we're talking about today, the societal level and how all those relationships create a web that sets kids up for success. With relational health, we're really talking about the quality and strength of the personal relationships, and that is the key component of some of the social capital that Robert will talk about a little farther along in the presentation, and how that directly contributes to the value and benefits derived from social networks. Next slide, please. So this is just a little bit deeper dive into what's meant with benevolent or beneficent positive relationships. So the safe component, making sure that the relationship is free from physical or psychological harm. Looking at stability, who is that adult the child can depend on, and the in or the nurturing component, and really that's across physical, emotional, and developmental needs, and consistently and sensitively meeting those needs. This whole set of things, the SSNRE, it's really an idea that the safe, stable, nurturing relationships and environment, there are shield from toxic stress. They mitigate the toxic stress response. It's really more focused on a solution focus and things we can do to create strong relationships that again mitigate toxic stress and ACEs, and in a whole build resilience both for children and for adults. Next slide, please. There's a ton of research looking at what does safe, stable, nurturing relationships and environments, what does that go along with? And we really see positive outcomes in the short and long term across health, across education, and across economic stability when we look at having more safe, stable, nurturing relationship. This slide in particular is looking at if you have more and greater safe, stable, nurturing relationships, it goes along with having less mental, emotional, and behavioral conditions. And really kind of the idea, if you have that, you have a child and who is coping well, and is at less risk for some of the more negative social emotional outcomes. Next slide, please. When we talk about relationship, you'll see the very familiar MTSS pyramid that I know many of you work with every day. In terms of relational health and social components, we really think about the MTSS pyramid across both generations with children and adults. So with relationship, we think about that tier 1 or prevention. What kinds of relationship things can we do for everybody? So examples of this with relationship and safe, stable, nurturing relationships are things like reach out and read. It's also things like play, positive parenting. All of those things are base and things to promote across all kids to set them up for success. In that tier 2, with more targeted interventions, we see a lot around addressing social determinants of health needs and mitigating the toxic responses. And then finally, at the top of the pyramid, we see treatments that really focus in on mitigating toxic stress symptoms, clinical interventions such as parent-child interaction therapy, and many other interventions to trauma-focused CBT. Really, many of our child behavioral interventions focus in on that relationship and how to help advance that relationship when children have experienced toxic stress.
And Evelyn,
Next slide.
I
Yes, please
appreciate,
do. Thank you.
no, I just wanted to say that I really appreciate that tier one is the biggest tier. Because, I got into this work and a lot of the work at Telehealth Rocks comes from the idea that instead of treating the problems and the results, that let's deal with the environment and the issue, let's create healthy environments for all kids. So I just want to point out, I really appreciate, that, and we're working really hard to really focus on that tier one, because we know it's going to create less need in tiers 2 and 3.
Appreciate that too. Like I really like this pyramid too because the be well is in really large letters. And let's do that instead of, hurting children and so, where they need tier three. I do want to emphasize what you just said is important that even children who also need tier three services, they really benefit from strong tier one. So tier one is for everyone. And so I really I appreciate what you said, Robert. We'll go to the next slide. And so when we ask you to think about that one adult in your life who was an inspiration, probably for many folks on the call, they thought of someone from their school environment. It could have been a teacher, it could be the person in the lunchroom, it could be the administrator. Really, everyone in that school environment is often the ones creating this safe, stable, nurturing relationship and being that one person that helps that child. I just pulled an example from Kansas and some of the work our own Department of Ed is advancing around this important area. Again, I'm not the expert on this. I know that we have folks on the call who know a lot more about it than me, but I really like how it talks about um, relationship and each student developing social, emotional, and character competencies that promote learning and success in life. You see a really important list of those things, really practicing good citizenship as respectful, responsible, empathetic, and ethical individuals, and really what we're all aiming for in supporting children. That last point I think is especially important that because these are skills, they're all things that can be learned. So for every child, we can help by modeling, teaching, practicing, reinforcing all the things with safe, stable, nurturing relationships. They're all things that skills that can be taught and supported with kids, and that's really good news. It's not it's not something magical. It's things that we can actually do each day, and many of you on this call do each day to set kids up for success. We'll go to the next slide. Kind of similarly, I know our own Telehealth Rocks program is fortunate to be doing some more work with whole school, whole community, whole child, and healthy schools models. So again, just saying that they align really closely with the social and community context, social determinant of health, as well as relational health. When you look at all the areas covered by the WIS model, really each one touches upon relationship. I think one thing that stood out to me is it is, of course, strong relationships for children and their resilience, but WISP also encompasses really encouraging strong relationship for adult and the adult resilience too, and looking at how that's a win-win when both kids and adults can maximize strong relationships. Next slide, please. And so I know many have heard of ACEs, and so I thought it would be helpful kind of to look at relational health. I see I misspelled. It should be benevolent childhood experiences. So my bad. The BCEs are really again that other side of the coin, where it's these core set of 10 have been tested and again have had really good short and long term outcomes. Um, it's now grown to a list of 20, but I wanted to focus in on this core 10. It's things like having at least one safe caregiver, having at least one good friend, having beliefs that give comfort, enjoying school, having at least one teacher who cared, having good neighbors, having an adult who could provide support and advice, having opportunities to have a good time, having a positive self concept, and having a predictable home routine. Um, it really aligns, I think, with a lot of um, what we aim for in my field with child psychology, and really all of these go along with that. And then um, what we aim for with that tier one that we were just talking about, all these really align with that too. So I hope you'll keep these in mind as Robert talks some about social capital, because really the two go hand in hand. Next slide.
So I guess this one's me. So as we kind of move into this section, I did want to say that we've really heard from our audience as well as our own experience, and we're really excited about doing some work on positive psychology and even hopefully having an echo series in the near future where we'll look at some different approaches to positive psychology. I know when we talk about the social determinants of health, we often talk about sort of negative life experiences. And this one allows us to begin to transition as we think about positive life experiences that lead to education and success. So the Search Institute launched the Social Capital Assessment and Learning for Equity Project in 2020. They received funding for the Bill and Melinda Gates Foundation. And so this idea of social capital is one I've used in my whole career, probably because I read Bowling Alone when I was in graduate school, and Robert Putnam really became kind of the buzzword, right? Self-efficacy and social capital were the buzzwords of the early 2000s. But this idea that everything that we do in our success comes from a web of relationships. So when young people can access and mobilize to help improve, their relationships are what help them mobilize and access the things they need to have successful lives. So from this, we learn that all youth and young adults benefit from positive relationships, and increases in their social capital leads to both school and especially life success. Next slide, please. So when we talk about what is social capital, it's this web of supportive relationships. So Evelyn talked about it in SSNREs. It's this idea of the resources that are wise that kids have. And we know that kids that may come from poverty or, experience other social determinants of health, another big issue that impacts them is they may not have access to the kinds of web of relationships. One thing we talk about when we talk about hope is if I have a problem, do I know 2 or 3 different ways I could resolve that problem? That's a sign of hope. That's a positive sign of hope. But when we know people don't have economic resources and all the other social determinants that we've talked about as we've gone through this series, they often don't have that web of relationships that can help them feel confident and positive about their ability to be successful. So a lot of the work that we do at Telehealth Rocks is about how do we create environments where kids have a resource, where they have self-confidence, where they have self-efficacy, they believe, and families believe that they know how to resolve their problems, they know how to reach out to get the help they need. So when we talk about social capital and students with high social capital, then they get from that, they have the skills to succeed in school, to have college and career opportunities, to believe that college and career opportunities are for them. I'll tell you, the first migrant kid I ever worked with that went to college, we knew he existed. His sister and brother had a lot of issues, and we focused on them. I happened to come into his house one day, and he was there. He had just come home from track practice. He had never been a kid that was really a problem or had big issues. And I was going to take his sister on a college visit. She was a sophomore. We discovered he was a senior, and no one had ever taken him on a college visit. And so I spent that whole year trying to figure out how to help this kid get into college. First thing I told him is you're going to have to got some bad grades there. You're going to have to get them up. Well, he made all A's that year. Um, but what I found out later was I was the first person who had ever accepted or proposed that he had a life beyond working in the apple orchards. He just thought he was going to graduate high school that year, go into the apple orchards. Well, he's now a professor of education. So it does just, it takes one, but it also takes helping kids understand that, one of the things I work a lot with justice, juvenile justice, and one of the best things I've ever heard was hearing someone from a juvenile justice agency say, I don't want kids to be here. I don't want kids involved with our system. But if they are involved with our system, I want them to know this is the start of something. This is the beginning of success. And I love that idea. And then, of course, being prepared for life and work and success in life. Next slide, please. So this web of developmental relationships, their supportive relationships are most strong when they're developmental. And so a developmental relationship are those close connections through which young people discover who they are, gain abilities to shape their own lives, begin to believe that I'm the person who's responsible for my own success, and they learn how to interact and contribute, I can't say words today, to the world around them. Next slide, please. So there are 5 core elements to developing a developmental relationship, and that's a lot to say. Show me that I matter, push me to keep getting better, help me to complete tasks and achieve my goals, right? Was right there side by side with that kid going on all these college visits, and I apologized later because I had no idea how to help him get into college myself. We went on so many college visits trying to figure things out, but we got him into college. Treat me with respect and give me a say. What do you want? Even the assumption that you might have considered college is sharing power with that kid. And also helping him decide whatever it is, even if it's not college, and then connect me to new ideas and opportunities. Give me an idea help me believe that I have other opportunities besides the ones that in my viewpoint from my environment and surroundings, I may think are the only ones I have. Next slide, please. So when you have developmental relationships, then that increases social and emotional competency. It increases academic motivation, GPA, your perception of instructional quality and your belonging in your school. You believe that there's a purpose to be in school. When we talk about truancy and other issues and behaviors, we also have to talk about what does that school feel is, why does that child feel school is important? Do they believe that being in school matters? Things like that. And then it also increases that sense of belonging, agency, and self-efficacy. Another big word I love, self-efficacy. Next slide. So I'm going to pass back to Evelyn to talk a little bit because this issue comes up so much, social media.
Yeah, thanks, Robert. So this is just more elephant in the room type of slide where just acknowledging that there's been really rapid changes in relationship and how kids are spending their time and with nearly half of teens saying they use the internet and social media almost constantly, just really saying that the things we're talking about today are so important um, because we see real risk with more isolation and not having the depth and meaningful relationships that we have been talking about. Um, so the relational health part really figures in here with the trusted adults playing a crucial role in navigating social media opportunities and risks and really thinking about um, how children have relationships outside of social media and the real meaningful relationships to do the powerful things that we've been talking about throughout the presentation. I could talk about this topic for a whole hour and I won't, but just saying that it's an important component as we think about how kids are making relationships today. Next slide. This is just our slide to cue us up. We're so excited to have the presenters today. As you hear their story, just really thinking about, you'll hear a lot about how they use continuous improvement to see an important challenge and through their continuous improvement and really determination, address the social determinant of health challenge. Next slide, please.
Well, I'm so excited today to have our featured panelists. So one thing I've discovered in life is often we see the same problems and we come up with similar solutions. So I've been at this for a while, and way back in 2017, we were working with community health workers, and I was a CEO of a federally qualified health center, and started working with schools, and they were talking about sort of these social determinants of health needs and how they impacted education. And so at that time, I put a community health worker in a school. And since then, our program here at Telehealth Rocks works very closely with that. I was at a meeting that Department for Children and Families had in Kansas City, and Stacey Tweedy was there talking about this amazing program that Department for Children and Families had established, first in the Emporia school districts and then in the Hutchinson district as well. And I was like, this is exactly what we do. It's so interesting that we do such similar work. And since then, I've become a very close partner with Department for Children and Families because so much of this work impacts that work. And so Erica is the Family Support Specialist Liaison with this program in the Hutchinson School District. And since then, I've gotten to know her and talked with Hutchinson schools and see their strong commitment to keeping this program going because it's such an important part of what they do. But I don't have to talk about these people. They're going to talk about themselves. So let's go to the next slide and we'll talk through some questions. I did want to say as well, I hope people, as they have questions about anything we've talked about today, and especially as they have questions for our panelists, please speak up. We're happy to talk about those. If you don't ask questions, I will. So we're going to start as you think about your questions, and you can put them in the chat or just unmute to do them. So Stacey, I just wanted to hear from you a little bit about how community supporting families started in schools. Why did DCF start that or begin partnering with these school districts? And what were the needs that you saw from your perspective?
Good morning. Thanks, Robert, for having us. So this is my favorite thing to talk about. I could talk about this all day long, but I won't. So here we go. So how we got started was back at the end of 2020. So, we were all living through COVID. And on the national level, even there is this conversation about poverty versus neglect, and how do we keep families who there are no concerns of abuse or neglect, but there are like states receive intakes about families. So there are worries. And in Kansas, we assign those as families in need of assessment cases. And so again, those are families where there's not worries of abuse or not worries of neglect, but there is usually services that families need. And so the conversation really was about how do we keep families from coming to the agency's knowledge, because, then it's like that's stressful for families if they don't need us because there's abuse or neglect there. So we started having this conversation about what that might look like. And we know that our education partners see kids like they're the everyday touch, right? They see children every day. And so how might we come up with a solution to have someone available to intervene at the very first moment that it looks like something has changed in the life of a child? Like, things are not normal, not how things are, how they normally come to school or whatever. And because we know once DCF gets involved, sometimes families aren't very cooperative, and they're not uncooperative because they're difficult, like they're scared. There's fear, like they've had past experiences, as a child or, as an adult with the agency. And so how could we, in some of those cases, have someone to intervene before the family ever came to our knowledge? And so we did lots of work. We were actually part of a National Governors Association. Kansas was one of the states that was selected. We worked a whole year on this project. Emporia School, Dr. Harder, the superintendent, actually was on our initial team. We got Emporia up and going in 2022. Worked all of 2021 on it. And then the second really part of second half of 22. Hutchinson schools also came on board. And really both districts have been fantastic. The specialists are wonderful. They work for the school districts. They do not work for DCF, but the agency has an interagency agreement with those districts that offset the cost. So it's a grant for a period of time.
So Stacey, can you, not Stacey, excuse me, Erica. I'll go. I always mess things up. Can you tell me a little bit, one of the things that was interesting, is you guys kind of saw this happening in Emporia, and then you wanted in on that. And so I'm both curious about kind of why did you see the need for a program like this in your school district, but also can you tell us a little bit about being a family support advocate, which I think I just got that title wrong, but
You're okay.
know.
Yeah. So I wasn't here when they decided that they wanted to do this, but I worked directly under the people who wanted to bring the program in. And they just saw kind of the same thing that, Stacey was saying, is that we have families who need support, they need resources, they need somebody that they can reach out to, and we need somebody that our teachers can communicate with for needs that are not abuse and neglect, so that we can kind of take care of ourselves, maybe like a holistic approach. So, thinking along those lines, that's why they really wanted to start the program. Now, I'd say I don't have the exact numbers, and I maybe should have, but I would say at a minimum every month I'm working with at least 30 children. Some months like that all the way doubles. So it's really varies, but it's obviously very beneficial, very impactful. And it isn't just working like with their families. Like I said, it kind of came naturally, but really being a person for our educators to reach out and talk things through with, like, say, I have this student and I think this is a concern, but I don't know. Like, I don't know what I should do, who I should reach out to. So just kind of being here in the school, somebody that everybody feels, comfortable and safe talking to, and then we can make decisions together if, it is a DCF report, or if it's like, let's just reach out to them and see what we can do. And I think that's been, a really big benefit for our school district.
So what are some examples, or kind of what are the variety of things that you routinely work on with kids and families?
So attendance, since I've been here, one of the things that has been a problem when I met with our local DCF and then all of our administrators, was truancy, and making sure we kind of came up with a consistent plan for truancy. So I helped them kind of create their plan, how they were going to pull that, and then how we were going to work with the families, hopefully before they had to go through truancy and get to the point of needing to have a court situation because of truancy for her attendance, but also resources, housing, food insecurity, sometimes behaviors at school, helping families navigate medical needs, mental health. But really, it's taking the time to meet with those families, know what the schools are saying, but hearing what the family really thinks and has as their concern, and walking with them to meet those concerns. Because what we see at school is only a portion of maybe what's going on in their home and what they really need, that support with.
So Stacey, I was curious, so why did DCF see that it was important to have this be a school district employee and be someone who, really represented the school district in this work?
Yeah, it's a great question. So we know that our education partners see children every day. Like sometimes they're the only other entity that sees a child outside of their home. And so it made the most sense that that's where this partnership would start. Also, families have lots of connections at school, and generally school is a safe place. Like, families feel safe at school, children feel safe at school. And so it just seemed to make sense that that the intervention was at school. it just seemed like the right place to do it. I also want to add, Erica, I do know your number. Since the inception, since Erica started in August of 22, she has served over 1,200 students, which is phenomenal.
Oh, Pamela Thompson asked a question that we may have to tag team on, which was, how are these different than community health workers? And we've had conversations such, with Hutchinson and Emporia schools. And one of the things that is really important to me is no matter who the helper is, no matter who this person that takes on this role, in some districts are fortunate to have a school social worker. Other districts, the districts that we tend to work with have school-based community health workers. Erica, I know that's kind of putting you on the spot because I know you don't work a lot with community health workers, but what do you think is specific about your approach, or the approach that Hutchinson is taking through this program?
You're right, I don't know as much about community health workers, but I would say for our program, like I said, I will meet with the family, and sometimes that initial meeting is an hour. Sometimes it's longer, sometimes it's shorter, but it's meeting with them and listening to them and really getting to know them. So it's on their time because this is obviously their life and I'm trying to help, and I don't ever want to just assume that I know about them. So it's really, listening to them and working with them. And then relying on, the school district to provide information to me that I might need, especially, they're the ones making the referrals, but it's really working with the family and walking alongside them in whatever they need.
And I think that's key to whoever it is, still social
Yeah.
work, but I don't care what you call it. I
Right.
am, we use a model, community health workers, because they, for us, it's a credential provider, we have our reasons, and also because that's just what I know. But I don't, I am more concerned and hope that schools can identify a resource that can help families with this. I don't really care, other than I hope they do, that they take an approach that works and that's family supportive and all the things we can talk about.
Right.
But there's no special sauce in community health workers or family support. It's just having someone there. The way I talk about it a lot, and not to go on about about my side of things, but is, I talk about in systems, often the family, the child doesn't have somebody on their side to talk about safe, talk about how we're talking about things today. So it's just whoever that person is, the goal is to have someone that can help that family understand the system, can advocate for that family with the system, but also represent the system, whether it's the school or DCF or someone else, to talk about ways that they're doing things that make it hard. We ask, why don't families do this? Or why doesn't the student do this? Sometimes we have to ask, why are we doing it in this way that makes it hard for them to do it?
Yep. And I think it's also really important is I try to help the families that I work with learn how to navigate things. So we might only be working on getting to a pediatrician, but calling and making an appointment and getting your insurance card and filling out the paperwork and making sure you have all the documentation you need, it's the same system, and you can just transfer it to the next thing that they might need to work on or do without me. And so that's something that I think is really important, is making sure that the families that come and I work with have then a skill to help them later.
Before we move on to the community context, I know a comment came up about truancy. And so, Eric, I'm really interested because I know you said you work a lot with truancy issues. So tell me, like, what's important when you talk or work on this, or kind of how do you go about working on this, on these students and these families' needs?
So I think for us in Hutch Public Schools, the biggest thing we had to figure out first was administratively how we're going to make a process be consistent and early. So like detect the problem before it's 40 attendance concerns. Make sure we get into a family and talk with them when it's 2 or 3, that we're starting to see the pattern, and making sure that we're not just sending that letter. so that if we do send a letter, we've got, you know, the contact information of who they can reach out to, but we're also following that up with something in person, or a phone call, so that we are making a connection. A lot of the time, not every time, but a lot of the time, it's don't know, don't do any better. So if we can teach them soon, they will start changing their habits and attendance can improve, especially with our younger kids. When we get into our older kids and it's their choice, you know, to like skip class, that's something different. But especially with our younger students, it's really teaching the families the expectations early. Um, Sorry, I saw that question pop up. And then also working with them and helping them outline, you know, who their supports are. So if it's transportation that's a problem, you know, because we don't bus in Hutch Public Schools very rarely. So who can help transport, or who can be your backup person if, you know, you're sick and they need to get to school, or if your tire is flat. So just helping them kind of have that plan in place, because that's the other thing that they come as well. Things happen and we can't get to school, or we don't have a way to get to the doctor to get a doctor's note. So just making sure that, you know, you're preemptive and you're doing things before it's a problem, and just kind of outlining as many supports as possible.
And I wanted to reiterate something that Pamela said. One of the things I talk about truancy is a symptom, it's not the problem. So we have to understand, why is that child truant? It can be transportation, medical issues, taking care of family members, and it can be issues with school or behavioral needs as well. And we have to get at what is causing this, because truancy is just a symptom. It's not the problem. So I want to, before we kind of move into talking more about the school and community relationships, I was really curious from both of your perspectives, you know, why did you see the need to have this kind of school-based support or earlier support for students and families? And I'll start with Stacey. Like, so what was DCF's goal in doing this?
Our goal really was to reduce the families coming to DCF's knowledge when there was not abuse or neglect reason for them to do so. Knowing that we can be kind of scary feeling when we show up at someone's door. And many times in those cases that are assigned as those families in need of assessment, when our staff were getting those cases, they were simply referring a family to local services that were already there in the community. And so it just makes sense. Communities and families are their own experts. Like, families know what they need, and our communities know what services are available. Like Erica in Hutchinson, like if you needed something in Hutchinson, Erica could tell you where that is, how to access it, what do you need to go with it. And so it just feels less intrusive to families and less traumatic if we can not be involved as a state agency when we're not needed. So if the families can directly, if Erica can directly give that family the name of that resource and how to connect, and even do a soft handoff, you know, calling, saying, hey, you know, Miss Smith's on her way there. Like, that just seems like the right thing to do for families and for kiddos, right? I hope Erica gets to share some of her success stories, because she has
Yeah.
some very sweet
Erica,
ones.
tell us a few examples where you really feel like this made a difference for a family.
Goodness. Okay. Well, this year I had, I mean, I have multiple for many years. I don't think, Stacey, you've heard this one. This year I have a student who is very medically fragile. English is not their first language and they're new to the United States. So adding all of that together, the school saw all of these concerns, but didn't know who or what, or even what they should do. So they reached out to me. My idea was to just get everybody into a room together and have a conversation, get a translator. So mom, you know, was hearing this in her language, and we were all just talking together. From that meeting, we got the student into a better fit classroom, a a schedule that gets her time with some other students about her age that also speak her language. So hopefully she can have some of that communication. Then we found ways to help afford some of the medical costs. She has to see a neurologist, and it's mostly out of pocket. So, getting some of that taken care of. I went with them to appointments because there wasn't a strong translator available at the medical appointment. And so I met with them and a translator prior. So, I knew some of those concerns and I could speak English. And then that translator was able to translate some of the basics to mom. She also ended up having to be in the hospital this year in Wichita. So helping them figure out how they were going to afford transportation, because that means mom's not at work. So really this is just one case, obviously, but just being there and available for a family in probably one of the hardest situations they've ever had to face, somewhere new, somewhere different, and whatever they needed. And now, I've got a really great relationship with the mom, and the little girl just loves whenever I come see her at school. So just kind of, keeping that and making them feel safe and know that they had somebody, and making that connection with them within our community, within our school district, and that's just one of them. Like,
Before we kind of get to sort of some of the final, well, what makes a partnership work, I did hear you say something earlier that I think I understood. And if I misunderstood, Erica, let me know. But one of the things you mentioned was the family identifying the issue that's important.
yeah,
And so yeah, so tell me a little bit about that, because that's something I agree with. I talk a
yeah,
lot with our CHWs about, you may think this is the family's problem, but if
right.
they say that's the problem, then you help them with that. And is that about building trust, or why do you think that's important?
So I think that it's important for a lot of reasons. Building trust, yes, is one of them. But if I'm going to work with a family, I want that family to work with me. I want them to be just as gung ho and ready to get things taken care of for them. And if I'm telling them what they need, or what I think, or what the school thinks they need to do, it's less likely that they're going to buy into that. And I don't want to spend a whole bunch of time focusing on something that really isn't as much of a concern to them, because everybody has different ideas on what is, acceptable, different cultures, different, just what they're used to. So it might not be something that is a big problem to them. However, there's another aspect to their life that they really could use support with, that they really could benefit from having somebody work with them. And so that's why, yes, I take into consideration what the schools say and try to, pop that into the conversation whenever possible, but really listening to them and building that relationship with them, and then moving forward on what they think is important in their life. That's why I think it's necessary.
I appreciate that. So we have a few minutes left, and we haven't gotten to the big thing, which is, or one of the big things. Everything we've talked about is big. But when you talk about this partnership between actually a state agency, a community organization, the regional office, and the school district, what do you think is important about the partnership? But also, kind of what were the challenges? Stacey, let's start with you, since you were there kind of at the beginning.
Yeah, so I'll talk about the challenge, and then Eric, if you want to talk about the partnership with the local office, that would be great. So in the beginning, when we were working with Emporia School District, I will simply just be honest and say the challenge was when we, like, Dr. Harder and I had worked on this team for a year together. And so when we were moving towards, hey, let's look at this, let's look at a position, and us doing an interagency agreement with it, I think it might have to her felt like too good to be true. So we don't ask for data. The only piece of data that we ask for is the number of families or students that each of the specialists serve each month, but we don't ask for names. We don't ask for anything else. Occasionally when I'm going to speak about it, if Erica or Sarah can join me like today, they do. Otherwise, sometimes I'll say, hey, can you share a couple of success stories with me? And they both do. Generically, I don't get any names of families. I don't get any other details. And really the interagency agreement was for them to do true prevention work, for them to really, be that intervention for families and to build those relationships. And it all is about relationships and community, right? And that's it. Like, we wanted to see a reduction in those FINA intakes, but really the goal was for them to do true prevention work. And so just in the beginning, that challenge was like having everyone understand, like, there really is no strings attached. Like, we really want to do true prevention. And then just trying to figure out, okay, what that looks like. So, who does the person work for? And we knew we didn't want a DCF employee. We knew we wanted it to be a school district employee. And so we helped give direction or like guidance on maybe what a position description might look like. But the districts made it to fit their own desires. And each position description for those two districts who have it look different. And we meet with them a couple of times a year just to see how things are going and if they need anything. Those grants are coming to an end. Emporia has decided they're going to use some of their at-risk funds. So if you're in a district and you're on this, you're wondering like how's someone going to cover that. Emporia is going to use their at-risk funds to help continue the program. So it will be ongoing. And Hutch, I think, is still looking on how they're going to continue that. So yeah, that was kind of our challenge.
So Erica, in about 1 minute, because unfortunately we have to finish up.
Yeah.
What do you think is important?
So I think it's important. I meet with our DCF, so we have quarterly meetings, but also they communicate with me. The supervisors have made sure that I'm sorry, I blanked on what they're called. The workers know that my position is available. So when they have a family who's within the district, I'm able to join if they think it's necessary or if they need help and supporting this family. They're able to reach out to me. Like Stacey mentioned, I know a ton about Reno County. So I've even had some of their workers say, what can we offer to your families, or what can we offer to this specific person? And I'm able to help provide some of that information. So just having a good relationship with DCF has also been, very helpful.
Thank you. So let's move forward, and I want to thank you guys both. I could talk all day about this. The next slide, please. So just really the key takeaways to remember that early and ongoing relational health and safe, stable, nurturing relationships environments really help kids build and families build social capital and lead to success. That you thrive when their interests are connected to opportunity and they believe that they have opportunities in life. And we learned so much today from Stacey and Erica, but really that building the relationship, understanding that the school district and DCF have a common goal and needs. And that's how, that's why they came together to support kids and families. So next slide, and I think we'll close up, and there's the resources. Next slide. And thanks for attending. So our next session will be the final session in the series, and we'll be discussing economic stability. We kind of moved at the end because that's just a little tease. We're really pleased that Matthew Desmond, who's the author of the books Poverty by America and another book on housing that I can't remember the title right offhand, will be doing a webinar for us in April. So kind of leading up to that talk on poverty and housing issues and other things related to the social determinants. Please email us with questions. Also, if you have any questions for Erica and Stacey, we can get it to them at Telehealth Rocks, or I know they're both happy to answer or talk about anything from their perspective. And I hope everybody has a great day.